In medicine, we've always been masters of the present moment. We react to the data we have right now. But what if we could see the future? What if we could forecast a patient's lab results weeks in advance, or predict a sudden decompensation in the ICU with hours of lead time? What if we could visualize the likely trajectory of a patient's cognitive decline in Alzheimer's disease over the next 2 years? This isn't science fiction. AI can now do something we once thought was impossible. It can predict a patient's future health, not with a simple risk score or a single isolated data point. We're talking about an entire trajectory, a continuous, dynamic forecast of a patient's physiological journey. The technology making this possible is the digital twin. A digital twin is a computational copy of a real patient, constantly updated with their unique clinical data. It learns their individual patterns, creating a personalized model that can simulate what might happen next. And a groundbreaking new model called DTGPT, powered by the BioMistral AI Foundation model, is demonstrating just how powerful this approach can be. Recently, a study on this model was shared by Dr. Itzel Fair on LinkedIn, sparking significant interest and a lot of questions from the clinical community. That's why I've created this video. This is a full-length, physician-led breakdown designed to help clinicians like you understand the research, the science, and the real-world impact of this technology. My goal is to cut through the hype and provide a clear, evidence-based explanation. Please note, this content is for educational and informational purposes only and should not be considered medical advice. If you're a physician, a nurse, a PA or NP, a pharmacist, or a health system leader trying to navigate the future of healthcare, this is for you. We're going to move beyond the abstract and into the practical. Over the next few minutes, we will cover 4 key areas. First, we'll establish a solid foundation on what digital twins are and how they differ from our current tools. Second, we'll dive deep into the DTGPT study itself, the datasets, the methods, and the remarkable results across oncology, critical care, and neurology. Third, we'll walk through concrete clinical scenarios to see how this could change decision-making at the bedside. And finally, we'll outline a practical framework for how a health system could begin to implement this technology safely and effectively. My aim is to equip you with the knowledge to not only understand this evolution in predictive medicine, but to lead the conversation about its responsible adoption in your own practice. And as a brief aside, if you're interested in exploring how AI can be used safely for patient education today, you can try my free educational symptom analysis tool at myaidoctor.ai. Now let's begin by defining what a medical digital twin truly is. Let's break down the core concept. The digital twin. A digital twin is a virtual patient model built entirely from clinical data streams. And once built, the AI simulates how that patient will change over time. It's not a static snapshot. It's a continuously updating predictive engine. It can simulate disease progression, medication responses, risk of deterioration, organ function trajectories. Think of it like a medical weather forecast. You don't just see the current temperature, you see the next 24 hours, next 2 weeks, next season. This is the future of preventive and predictive medicine. Now let's talk about the study itself. DTGPT is a large language model fine-tuned on biomedical data, but the key innovation is its forecasting ability. The study evaluated 3 datasets: non-small cell lung cancer, ICU patient trajectories, Alzheimer's disease progression. And what makes this remarkable is that each dataset represents a completely different clinical domain. Yet the model performed consistently across all 3. The study reported improvements in accuracy, cross-lab understanding, zero-shot prediction, and multi-future simulation. To truly understand the power of DTGPT, we need to examine its performance across diverse and challenging clinical environments. We'll start with oncology, a field where treatment decisions are complex and the stakes are incredibly high. The first dataset we explored involved over 16,496 lung cancer patients undergoing treatment. This wasn't just a snapshot, it was a longitudinal view of their entire treatment journey, capturing the subtle and often dramatic physiological changes that occur during chemotherapy. For each of these patients, DTGPT was tasked with a formidable challenge: predict 13 weeks of future lab values. This long-term forecasting is critical as the consequences of chemotherapy can manifest weeks after a dose is administered. The model forecasted a comprehensive panel of labs essential for managing chemotherapy. This included hemoglobin, which indicates anemia and fatigue, the absolute neutrophil count, or ANC, a critical marker for infection risk, and platelets, which are vital for blood clotting. It also tracked key indicators of organ function, like creatinine for the kidneys and bilirubin and albumin for the liver. These aren't just numbers, they are the language of the body's response to treatment. So why does this matter clinically? Why is a 13-week forecast a potential game changer? Because chemotherapy toxicity is often delayed and unpredictable. The drugs that kill cancer cells also affect healthy, rapidly dividing cells, leading to side effects that can emerge long after the patient has left the infusion center. This creates a constant state of clinical uncertainty. Consider this common scenario. A patient on a carboplatin-based regimen comes in for a follow-up. They feel fine, their current labs are stable, and they appear to be tolerating treatment well. But beneath the surface, a different story is unfolding. The digital twin, analyzing the patient's unique history and treatment data, predicts that their ANC will crash in 2 weeks, hitting a dangerous nadir that puts them at high risk for a life-threatening infection. The digital twin warns early, transforming reactive care into proactive management. It provides a probable trajectory, complete with uncertainty bands, giving the clinical team a window of opportunity. This foresight allows for preemptive dose adjustments, the proactive scheduling of growth factor support, like GCSF, or simply arranging for an earlier follow-up lab draw. It's about making informed decisions today to prevent a crisis tomorrow. Now let's shift from the weeks-long timeline of oncology to the minute-by-minute intensity of the intensive care unit. The second dataset included 35,131 ICU patients, representing a massive repository of high-frequency, high-stakes clinical data. Here, the challenge for DTGPT was different. Predict the next 24 hours of a patient's clinical evolution. In the ICU, a patient's condition can change in an instant, and the ability to anticipate these changes is paramount. To make these predictions, the model analyzed a continuous stream of data, second-by-second vitals, hourly lab results, the precise dose of vasopressors like norepinephrine, and the patient's oxygen requirements, whether by nasal cannula or mechanical ventilator. It synthesized this complex, multimodal information into a coherent forecast. Let's walk through another clinical vignette. Imagine a patient admitted with mild sepsis. Their lactate, a marker of tissue stress, is slowly rising from 1.8 to 2.2. Their blood pressure is borderline, but holding steady for now. Based on the current monitors, there's nothing overtly alarming yet. The patient is being watched closely, but the data doesn't demand immediate, aggressive escalation. But the twin, processing patterns invisible to the human eye, predicts a cascade of events over the next few hours. The vasopressor requirement will rise significantly to maintain perfusion. The blood pressure will begin to drop despite support, and the patient's oxygen needs will increase. The model flags that the probability of significant deterioration is high. This isn't a vague warning, it's a specific, actionable forecast that gives clinicians hours of early warning. This lead time is invaluable. It allows the team to prepare for escalation, ensure the right resources are at the bedside, and potentially intervene earlier to blunt the patient's decline into septic shock. Finally, we move to the domain of chronic disease and neurodegeneration. The third dataset included 1,140 Alzheimer's patients from a longitudinal study, a condition characterized by a slow, insidious decline over years. Here, the model's task was to predict 24 months of cognitive decline. This is about forecasting a patient's quality of life, their ability to function independently, and the support they and their families will need. It forecasted trajectories for standard cognitive assessments like the Mini Mental State Examination or MMSE, but it went further, also predicting functional decline in activities of daily living and identifying the individual risk of accelerated deterioration where a patient's decline suddenly steepens. Consider a patient newly diagnosed with mild cognitive impairment. They are still highly functional and the future feels uncertain for them and their family. They want to know what to expect. The digital twin, based on their specific clinical and biomarker profile, might predict a period of relative cognitive stability for the next 6 to 9 months, but then a noticeable decline starting around month 12. This forecast provides a personalized roadmap of the disease course. This information is profoundly helpful. It allows for early and realistic planning, helping families anticipate needs and arrange for caregiver support before a crisis hits. It can guide decisions about the timing of medications, inform discussions about home safety, and empower patients and their loved ones to make the most of the time they have. Across all three of these diverse data sets, the goal is the same: to use data to see the future more clearly, enabling us to provide better, more proactive care. So, how does DTGPT actually achieve this level of predictive accuracy? To understand its power, we need to look under the hood at the sophisticated architecture that drives it. This isn't a single monolithic algorithm, but rather a carefully orchestrated ensemble of specialized models, each playing a critical role. Let's break down the science component by component to see how it all comes together. At its core, DTGPT uses a powerful mixture of techniques. First, there's large language model reasoning. This allows the system to interpret the complex, sequential nature of a patient's electronic health record. It doesn't just see isolated data points. It reads the entire sequence of clinical events, lab results, and medication changes, like a coherent clinical narrative, understanding the story of the patient's journey over time. This is paired with dedicated time series forecasting. These are specialized modules or heads designed specifically to predict future numerical values. Think of them as the system's quantitative experts, focused on forecasting where a patient's lab values, vital signs, or other measurable parameters are headed next, based on patterns learned from thousands of similar patient trajectories. Underpinning all of this is embedding-based representation learning. This is a crucial step where the model translates all the diverse, multimodal patient data, from text notes to lab numbers to medication codes, into a single rich mathematical representation. This embedding captures the complex, latent relationships between different clinical factors, creating a holistic digital signature of the patient's state. This rich representation enables one of DTGPT's most remarkable abilities: zero-shot prediction. This means the model can predict a lab value it was never explicitly trained on for that specific task. How? By using its vast, latent medical knowledge. It understands the physiological relationships between different labs. For example, if it knows a patient's creatinine and potassium levels, it can infer a likely value for EGFR, even if EGFR wasn't a direct target in its training, effectively filling in the blanks with medically plausible data. And perhaps the most impressive feature is its use of multi-future simulation. Medicine is probabilistic, not deterministic. Recognizing this, DTGPT doesn't just generate one single most likely future. Instead, it runs thousands of stochastic simulations or rollouts to generate a whole distribution of plausible future trajectories for the patient. It then performs probabilistic trajectory merging, averaging these possible futures to produce a single, stable, and more reliable forecast. This process also generates the crucial confidence bands you see around the prediction. These bands aren't just an afterthought, they are a direct, calibrated measure of the model's uncertainty, telling you how much agreement or disagreement there was among the simulated futures. This mirrors real-life clinical reasoning, where we consider a differential diagnosis, a range of possibilities, rather than betting on a single certain outcome. Because in medicine, as in life, patients rarely follow a single predetermined path. Digital twins can forecast chronic disease trajectories. A1C is 8.3. Twin predicts 9.1 in 3 months. If GLP-1 added, A1C stabilizes. It can predict heart failure decompensation. Risk stratification becomes proactive. Chest pain patient with borderline troponin. Digital twin predicts low 72-hour risk. predict chemotoxicity, hematologic drops, renal strain and nutritional decline, predict extubation failure, predict ARDS risk, predict hemodynamic collapse, predict depressive relapse, predict medication efficacy windows, forecast seizure frequency, migraine patterns, MS progression. There are 5 essential pillars for implementation. Digital twins are powerful but not perfect. Future digital twins will simulate medication dosing, surgeries, rehabilitation progress, organ failure risk, imaging-based progression, personalized therapy response. This could become the backbone of personalized healthcare. In 2023 Digital twins represent one of the most exciting frontiers in modern medicine. I want to thank Dr. Itzel Fair again for sharing the study. If you want to explore safe, educational AI for symptoms, try my tool and watch more deep dives on AI in healthcare on my channel. I'm Dr. Ahmad Saab, and this is how AI is transforming clinical medicine.